Hello and Minglaba, welcome to MI Radio's Myanmar Today. I'm Henry Zin. Updates on COVID-19 cases in Myanmar, 187 total confirmed cases Monday morning. Taking health guidelines serious, Yangon Region Government and volunteers conduct anti-COVID-19 measures in Hlinethaya and Tamwe Townships. Shanghai Municipal People's Government donates protective equipment to YCDC. And a story coverage on Yangon's public transport during the COVID-19 outbreak. All of that coming up later, but for now, let's take a look at what's happening in local news. The Ministry of Social Welfare, Relief and Resettlement has provided healthcare items to the camps of internally displaced persons in the battle against COVID-19 in Kachin and Shan states. The 18 IDP camps in Banwat and Parkan townships of Kachin state received 174 bottles of hand sanitizer, 3,993 soaps, 180 bags of lime powder, 20 thermometers, 2 sets of hand washing basins, 906 cloth face masks, 174 surgical masks, 2 hand speakers, 2 memory sticks with audio files of the COVID-19 awareness campaign, and 2 vinyl sheets printed for COVID-19 awareness campaign. Similarly, 7 IDP camps in Namkan, Kukai, and Namtu townships of Shan State received 3,916 cloth face masks and 824 bottles of hand gel. The ministry is providing both material and immaterial supports in Naypyidaw Council, regions, and states to prevent and control COVID-19 disease. A total of 90 Myanmar migrant workers returned through the Friendship Bridge No. 2 in Myawaddy on Sunday, the 17th consecutive day since the government resumed accepting returnees on the 1st of May, amidst the spread of COVID-19. A total of 720 workers have returned home so far since 1st of May. Local authorities are closely supervising the process of accepting the returnees in line with the COVID-19 fighting guidelines. The returnees on 13th and 15th of May were handed over by the Thai authorities to Myanmar on those dates as they had completed serving prison terms in Thailand. Those who returned on Sunday included 20 persons from Kayin State, 13 from Mun State, 27 from Bago Region, 9 from Magwe, 5 from Yangon Region, 5 from Mandalay Region, 4 from Naypyidaw, 6 from Shan State, 1 from Teninai Region, 1 from Rakhine State, and 3 from Ayeyarwady Region. Cyclonic storm Amphan has intensified to a severe cyclonic storm but has not shown any change in a trajectory within the southeastern and southwestern region of the Bay of Bengal, according to a weather bulletin issued by the Department of Meteorology and Hydrology at 2 p.m. on Sunday. The severe cyclonic storm was centered at 530 miles south-southwest of Paradip, India, 615 miles south-southwest of Digha, 675 miles southwest of Kapupara, Bangladesh, 460 miles southwest of Coco Islands, Myanmar, and 605 miles southwest of Patain. The cyclone currently shows no sign of heading towards Myanmar and is designated a code yellow. Cyclone Amphan is likely to intensify to a very severe cyclonic storm in the coming 12 hours and move in a north-northeast direction. Amphan is likely to cause scattered thunder showers in Naypyidaw and other states and regions between 17th to the 21st of May. It is likely to cause strong winds at 40 miles per hour and waves between 8 to 12 feet in height along Ayeyarwady Delta, Rakhine Coastal Region, and offshore. The Emergency Management Department of the Ministry of Social Welfare, Relief and Resettlement states that Cyclone Amphan may reach the northern region of the Bay of Bengal on Tuesday and become very severe, Category 4, and reach winds of 130 miles per hour. Cyclone Amphan is likely to head towards West Bengal, India, and Bangladesh border on 20th of May and enter the land, according to international meteorology agencies. While the cyclone is currently not heading towards Myanmar, it is estimated to cause strong winds of 50 to 60 miles per hour across the central and northern part of Rakhine's coastal regions and in southern Chin State. A total of 19 Chinese citizens illegally living in Myanmar were arrested in possession of weapons and illegal narcotics in 4 separate raids in Muse, northern Shan State, on the 15th and 16th of May. On 15th of May, a joint team arrested 10 Chinese citizens, including Lang Hua, son of Kun Hu Ta, at the Da South Tikor Entertainment Center of Winning Company Group owned by Hlinethaya in Swanso Ward, Muse, together with 15 laptops, 15 mobile phones, 3 monitors, 2 USBs, a CPU, a printer, 6 Wi-Fi devices, 7 Chinese phones, 10 laptop chargers, 10 computer mouses, and 7 earphones. In a separate raid at Elon Sound Spa in the same ward on the same day, 2 more illegal Chinese were arrested. On the same day, another 4 Chinese citizens were arrested at the house of Chainmon in the same ward, together with a gun, 20 bullets, a magazine, a 9mm pistol, 10 bullets, and a magazine. On 16th of May, the joint team raided the house of Li Ti-chen and arrested 3 Chinese citizens together with 2 M22 guns, 2 magazines, an M21 gun, an M16 gun, a magazine, a Luca pistol, a magazine, 25 kg of drug known as ice, 37.7 kg of heroin, and 120,000 stimulant tablets. According to the Office of the Commander-in-Chief of Defense Services, the narcotic drugs are estimated to be at 18,000 million jets. The suspects, illegal drugs, and weapons were handed over to the Muse Myanmar police station. That's all with the local news. Let's take a look at the first report now. According to the latest announcement of the Ministry of Health and Sports, 5 new confirmed cases of COVID-19 have been found and the number of cases in Myanmar have reached 187 Monday morning. 2 of the 5 new cases are found in Yangon State and 1 from the Hlinethaya region, which now has become the first occurrence in the region. 11 of the 14 regions and states in Myanmar have been infected with COVID-19 except for Gaya State, Rakhine State, and Ayeyarwady region. Pyotiritu and Zueman report.
According to the updated announcement of the Ministry of Health and Sports, 5 new confirmed cases of COVID-19 have been found, and the confirmed cases in Myanmar have reached 187 till the morning of 18th May. 2 among the 5 new cases are found out in Yangon State, and 1 case is from the Hlinethaya region, so which becomes the first occurrence in that region. Meanwhile, 97 patients, which are over 50% of the whole cases, have been identified as recovered cases, and 84 have already been discharged from the respective hospital, and the rest are kept under surveillance and isolated as hospital quarantine. 11 among the 14 regions and states in Myanmar has infected with COVID-19, except only Gaya State, Rakhine State, and Ayeyarwady region. The 280 townships countrywide are still free from COVID-19. Among the COVID-19 infected area, Yangon is still becoming the most infested area with 83 confirmed cases in 28 townships. Dr. Tan Haiso, Director, Health Knowledge Promotion Division, Ministry of Health and Sports, said.
The Ministry of Health and Sport is stepping up its current activity in anti-COVID-19 measures. At the moment, the public should not be bothered. The cases are not completely over yet. If we will not find out further cases for long, we can say the conditions are kept under control. So we will be safe only when the more new cases have not been found for long. The Ministry of Health and Sports has also seen working with the military to increase the number of tested. The current conditions are really great, but the public shall not be careless.
Insane Township is identified as the severe area for COVID-19 infection, as there are total 43 confirmed cases in Insane. Yangon, Saoklapa, Tamwe, and Bahan are also ranked as the high risk of COVID-19. Uwe Pyohan, local representative, Insane Township Constituency 2, said.
It is important to work in a timely manner at such times. Why do we have more cases in Insane Township is that we can work the cases in a timely manner. In Insane, once we found out a positive case, we trace the track of all the contacts, and the lockdown is promptly assigned to the respective places and the contact persons are sent to the quarantine center. This timely action led to the new discoveries of the positive cases. We should be worried about more silent carriers.
According to the Ministry of Health and Sports, 4 townships from Yangon Region and Gali Township from Zagai Region are lifted from semi-lockdown restrictions, and the rest 5 townships have been extended the semi-lockdown restriction indefinitely. And some of the shops, like restaurants and other businesses, are set to reopen on 8 May. Umimor is a local who lives in Kamayo, and he said,
COVID-19 ကာလမှာပေါ့နော်အဓိကအသက်ကြီးတဲ့လူတွေနော်အသက်60ကျော်တဲ့လူတွေအရေးကြီးတာဘာဖြစ်လဲဆိုတော့နော်ကျန်းမာရေးအထူးဂရုစိုက်ဖို့လိုတယ်
During this COVID-19 period, the elderly persons have to pay more special care. I am over 60 years old. Though the weather is really hot, I have to go out. But whenever I need to go outside, I wear the face masks. When I come back home, I wash my hands. Then I spray the disinfectant to me and my bags. One important thing is that I drink water well and care for my routine. We have heard from the news that the disease can be cured and can be restored, so it is best to take a safe distance when everyone is going outside.
The authorities are taking more actions to prevent the spread of COVID-19 in the states and region in Myanmar. And from now on, most businesses have started resuming operation as growing number of people are out in the street of most parts of the country. People live in the house without wearing a mask will soon be fined under the Prevention and Control of Communicable Diseases Law, as the regional government is now making necessary arrangements and details will be announced in the coming days. I am Pyote Ritu. This is news reporting from Myanmar Radio.
That's an update on COVID-19 cases in Myanmar. 187 total confirmed cases Monday morning. All right, we'll move on to the next report. The Yangon Region Government conducted anti-COVID-19 measures in Hlinethaya and Tamwe Townships with the help of the Ministry of Health and Sports to prevent the spread of COVID-19. Hlinethaya is also an industrial township full of working-class people and day laborers. And Tamwe is also a township full of big markets that are always crowded with buyers and sellers. The Yangon Regional Government and the volunteers in medical fields conducted anti-COVID-19 measures, including some factories in Hlinethaya Industrial Zone and markets in those townships.
The Yangon Regional Government conducted anti-COVID-19 measures in Hlinethaya and Tamwe Township with the help of the Ministry of Health and Sports to prevent the spread of COVID-19. As Yangon's population is larger than other cities, Hlinethaya is also an industrial township full of working-class people and day laborers. Tamwe is also a township full of big markets which are always crowded with the buyers and sellers. As there are COVID-19 positive patients in both townships, the Yangon Regional Government and the volunteers in medical fields conducted anti-COVID-19 measures there, including some factories in Hlinethaya Industrial Zone and the markets of those townships. Mintu, Yangon Region Lutto representative from Hlinethaya Township, spoke to Myanmar Radio about anti-COVID-19 measures through the phone interview. He said,
The Yangon Region Public Health Department suggested us to conduct anti-COVID-19 measures and awareness campaign in the crowded townships. So they did first in Insane Township, and now we are carrying out anti-COVID-19 measures in Hlinethaya Township. We inspected 140,000 people in Hlinethaya Township, including 6 wards and 2 big factories, namely Sangyi and YJ. We always launch mass campaigns because Hlinethaya is full of working class people with a lot of markets and street hawkers. So we delivered the masks to all the sellers and the buyers in the markets, like the big markets like Binglong and Migua. We also fined 102 people who do not wear masks on 14 May. After taking actions against those people became aware about it and they started to wear the masks.
A few weeks ago, the Yangon Regional Government also carried out anti-COVID-19 measures in Hlinethaya Township, where over 45 COVID-19 patients have been found. Hlinethaya is one of the virus-affected townships where found out the COVID-19 patients. Utan A, who is the ward administrator of number 6 ward from Hlinethaya Township, spoke to my radio about anti-COVID-19 measures and how they are conducted. He said,
We carry out fever survey in the whole ward from the building number 1 to number 95 with a total of 1,248 rooms and a population of over 20,000. As we know, 20,000 people is too many for all of us to finish in one day, so we have started survey some since 15 May, and we are going to inspect those people from the morning to the evening. We had already delivered the medical record sheets from the Ministry of Health and Sports before the start of anti-COVID-19 measures. The people have to fill these medical record sheets with their household list. Then the volunteers and health workers will measure their temperature and check their health condition and travel history. Previously, there were 5 positive patients in Hlinethaya Township. We sent them to Weibaki Specialist Hospital, and the rest of all those family members are tested negative, but we told them to stay at home during these days. As the ward administrator, we are holding the meetings to inform the people of the plan to launch mask campaigns and spray the pesticides twice in a week. I really appreciate anti-COVID-19 measures by the COVID Prevention Committee and the Ministry of Health and Sports.
Ko Myo Aung, who participated in anti-COVID-19 measures in Tamwe Township, spoke to my radio about his difficulty during the previous lockdown.
I am very pleased with these anti-COVID-19 measures. Tamwe is one of the townships which includes in the list of semi-lockdown. During this semi-lockdown period, we have lots of difficulties, but we know that we have to follow these rules for the security of our health. I always keep in touch with the COVID-19 update news from the Ministry of Health and Sports. For me, whenever I have to go out, I always put on mask and bring hand gel with me. When I get back home, I clean myself outside. I thank Yangon Region Government and other health workers for working for us in the front line.
Now, hundreds of factories across the country are being reopened in line with the approval of the inspection team.
That's a report on Yangon Region Government and volunteers conducting anti-COVID-19 measures in Hlinethaya and Tamwe Townships. Stay with us, we're going to bring you more reports on Myanmar Today. Shanghai Municipal People's Government donated several N95 masks and KN95 masks to Yangon City Development Committee for the staff of YCDC who are carrying the duty of cleansing wastes from virus-infected patients, hospitals, as well as for the quarantine centers across Yangon. The handing over ceremony was held last Friday, attended by the Vice Mayor of YCDC, Wu So-lin, and responsible persons from the Chinese Embassy. Williamson will tell us more.
In the fight of COVID-19, the role of Yangon City Development Committee plays very important as they have to make sure that the people who are kept in quarantine are properly looked after, especially in following rules and in cleansing the waste from the virus-infected people or people under quarantine. To carry out all these tasks, YCDC has to assign specific workers who are carrying out constant checking, and they must go through proper social distancing guidance as they work closely with virus-infected patients and the people who are put into quarantine. They make sure that they will prevent themselves from being infected. Therefore, according to Wu So-lin, Vice Mayor of YCDC, these YCDC workers go through almost the same procedures just like the quarantine people. In doing their duty in the front line of the battle, YCDC is also in need of all necessary protective equipment such as masks, PPEs, and other tools. But with limited resources, it is risky for the workers to perform their duties safely. Therefore, seeing this need of proper equipment and tools, Shanghai Municipal People's Government donated 30,000 pieces of N95 masks and 20,000 pieces of KN95 masks. And the handing over ceremony of the donation was held on 15th of May at YCDC in Yangon. Speaking to the media on how important role this donation will play in the fight against COVID-19, Usolin, Vice Mayor of YCDC, said,
Okay,ဒီပစ္စည်းကတော်တော်လေးကိုကျွန်တော်တို့လိုအပ်နေပါတယ်ဘာလို့ဆိုရင်ကျွန်တော်တို့ကမိုက်သိမ်းတဲ့ဟာတွေ
We are in desperate need of this equipment which we got today because this is the duty of YCDC to collect the waste from where people are kept in quarantine and where virus-infected people are being treated. But we cannot perform all these duties without wearing PPE and other equipment, and only when our workers are fully protected, then they can prevent themselves from being infected. If any staff gets infected, that will result in a reduction in the workforce and it will be very hard to fill the void. This is why getting access to all the required equipment is very essential here for us.
Even though YCDC received only masks on the first phase of donation from China, according to the statement released by both responsible persons from Chinese Embassy and YCDC, there will be the second phase donation where YCDC will receive PPE for workers who work in the front line of fighting against COVID-19. Due to limited and restricted amount of PPE in China, it cannot be shipped fast to Myanmar. Once PPE is being worn, it has to be destroyed by burning. However, therefore, there is a very limited source of this equipment. Speaking further, Usolun also said,
PPE ဝတ်စုံကလည်းတစ်ခါဝတ်ပြီးရင်သူကဖြစ်စီရတာ哦ဆိုတော့လိုပါတယ်
PPE is one of the most required equipment at YCDC for now, along with masks. We are deeply grateful for what we have received today. Although it is a crisis happening all around the world, including our neighboring countries, but our neighboring countries are still helping us despite their own difficult situation. To the people in Myanmar, please wear masks whenever you go out. The monsoon is going to set in here soon, and as usual, there will be flood in the time. Therefore, let us begin a new habit of wearing masks for the good of our health. We are all not used to wearing of the mask, feeling itchy or uncomfortable in breathing, but once it's become a good habit, then it is good for all. But what happens? It is quite expensive to buy disposable masks all the time. So as guided by State Councillor Daw San Suu Kyi, we can make masks by ourselves at home. Therefore, I want to encourage the people who cannot afford to buy all the time to use at least homemade cloth mask.
This is Ulinson for MI Radio.
Well, let's move on to the last report before we go to international news. In the regular video conferences hosted by State Councillor Daw San Suu Kyi, public transport is discussed, including the fact of health, safety and public transportation services and options of how to reduce the crowd of passengers on YBS and how to encourage the passengers to use Myanmar Railway more. Dora Swizin has more on the story.
It has been a month of COVID-19 outbreak within the country and the workplaces intend to resume operation more and more. With the slow rate of COVID-19 confirmed cases detected, more and more people are going outside, especially more employees and workers return to the normal daily life despite the virus outbreak. In Yangon, majority of people use public transport when going to and coming back from work. Now, Yangon Bus Services YBS and Myanmar Railways MR are providing public transport services. To make sure health safety and to listen to the difficulties of the public transportation, State Councillor Daw San Suu Kyi hosted the video conferencing with U Aung Nimo, Managing Director of Yangon Region Transport Authority YRTA, Uzo Lin, Assistant Manager of Number 7 Divisional Traffic of Myanmar Railway, and Matt Nai, who is a regular YBS passenger.
Transportation is assumed as the important issue at present. Although the health guidelines are released, some fail to follow these guidelines when going from one place to others, such as waiting at the bus stops in crowd. When the government has eased some restrictions in some townships, people will go outside more if they are allowed, and transportation becomes more and more serious. Most of our people have to use public transport, so we need to consider the risks of public transport during this virus outbreak.
According to U Aung Nyinimo, before the outbreak of COVID-19, about 4,500 YBS buses ran within Yangon region in a day, transporting 1.8 million to 2.5 million passengers. At present, after the holiday period ended, 1,300 to 2,500 buses ran for approximately 100,000 to 300,000 passengers in a day. He reported that for the safety of YBS, YRTA supports the buses to be able to provide the mask to the passengers who are not wearing any. Hand sanitizers are available on the bus. Every day, the buses have to be sprayed with antibacterial and are cleaned according to the instructions of the Ministry of Health and Sports. Being the main public transportation, it is difficult to avoid crowd when taking YBS, so social distancing becomes a problem.
At the office hours, the buses are crowded with people going to and coming back from workplaces because some offices have already resumed operation. So although the passengers wear face masks, face shield or gloves, there is a problem to practice social distancing. The longest YBS bus is 10.5 meters long and has 36 seats. About 40 to 50 people can take the bus by standing on it. Even without people standing on the bus and just carrying passengers full on seats cannot give social distancing situation on the bus. So it is important to ensure personal hygiene before getting on the bus by washing hands and by wearing masks. We also place basins at the crowded bus stops.
Manai, who takes YBS every day from Tobong to Hlinethaya, also shared her experience that Hlinethaya has the most crowded passengers on the buses, and even the extra private ferries are loaded with passengers. And ferries provided by the workplaces are not sufficient. Second most commonly used of public transport is railway, but the train passengers are not as many as those taking buses.
Starting from 10th April, Myanmar Railways reduced the number of Yangon circular rails and long-distance trains. At Yangon Central Railway Station, we placed 10 basins for hand washing. Out of 55 stations along Yangon Circular Railway route, basins are placed at 28 stations. The most crowded time on the Yangon Circular Rail is the morning section of going to work, and all the seats are full. If 3 more rails can run in the morning section for Yangon Circular Railway, it can help reduce the passengers on each rail.
We cannot know how long we have to carry on the precautionary measures against COVID-19. We have to look forward to long term. So the government is easing some restrictions and is striving to have compromise between relief and restriction. It is not easy to stay at home for a long time. People have to go outside and use public transport definitely. We need to make adjustments for public transport. Now passengers are taking buses more than rail. If railway sector is developed, the passengers will take more. If the railway can provide the same services as the buses, it will solve the problems of being crowded on the buses.
The state councillor mentioned the workplaces and the companies to provide the ferries for the employees so that they would not have to use public transport, while TA is also offering to rent the buses, which are not running at the present, to use as the ferries for the workplaces. The state councillor also encouraged the passengers to take railway more if possible instead of taking YBS all the time. This is Dora Susan reporting from MI Radio.
And that's all we have for today's reports. I believe it's time now for international news. India on Sunday extended its COVID-19 lockdown until the end of May as it reported its biggest daily increase in new infections, but said some sectors will be allowed to resume operations as its economy takes a hammering. The nationwide lockdown is the world's biggest as it affects 1.3 billion people and has been in place since March 25th and extended several times. The restrictions have been devastating for India's poor, with massive job losses. Schools, places of worship, shopping malls, cinemas and gyms must remain closed, the ministry said, adding bans on large gatherings for religious and sporting events would also be extended. The ministry added that the city metro train service will also remain suspended alongside domestic and international air travel. Restaurants will, however, be allowed back in business for takeaway services, while sporting events will also be allowed in empty stadiums. China is boosting medical aid to African countries fighting COVID-19. It has dispatched necessary supplies and equipment to countries such as Tanzania and Algeria. Egypt received the third batch of donations on Saturday. In Algeria, medical experts gave prevention guidance for employees at a Chinese firm in the capital, Algiers. The Africa Center for Disease Control and Prevention has commended its Chinese counterpart for their efforts.
We thank a lot the Chinese government for the protective equipment against COVID-19 to our health workers in hospitals. They are important equipment and we will use them carefully so that to help our people who have infections.
In other news, at least 10 firefighters were injured while battling a large fire, according to the Los Angeles Fire Department. The fire caused an explosion and spread to several nearby structures. Take a look at the video. U.S. President Donald Trump said that the United States has been working on developing a vaccine for coronavirus since January 11th, 10 days before it reported its first case. The statement has left many wondering why Washington continues to point finger at China over the coronavirus when it had sufficient time to understand the gravity of the situation. Meanwhile, the Trump administration continues to be criticized for its America First approach to vaccine development.
There's a massive global effort ongoing to develop a vaccine for COVID-19, a substance which can provide immunity against this killer disease and finally put an end to the pandemic. Yet this week, American intelligence accused China of trying to hack into the vaccine research. Beijing played down the allegation, saying China had no cause for such behavior.
在当前新冠肺炎疫情全球蔓延的背景下，
China is leading the world in coronavirus vaccine research and treatment. China itself has more reason than anyone to be worried about internet theft. Slander and accusations cannot eliminate the virus or stop the pandemic.
At the same time, another question has also emerged. When we do get a vaccine, how will it be distributed? The French government rounded on homegrown pharmaceutical giant Sanofi on Thursday after its CEO said a potential COVID-19 vaccine would go to the United States first. President Emmanuel Macron's office criticized the statement, saying market forces had no role to play in distribution decisions. America First continues to be Trump's go-to strategy even when it comes to finding solutions to a global problem. On Tuesday, UK newspaper The Guardian criticized his solo approach to the global health crisis, adding that such unilateralism was only slowing down the process. It also referred to a virtual global summit earlier this month, where the likes of the UK, China, Canada, Turkey, and Japan, as well as numerous African countries and international organizations, pledged more than $8 billion towards vaccine development. The United States was nowhere to be seen. Despite this, the World Health Organization remains adamant that this is a global issue and no country has a right to claim precedence.
The Access to COVID-19 Accelerator is uniting efforts on many fronts to ensure we have safe, effective, and affordable therapeutics and vaccines in the shortest time possible. These tools provide additional hope of overcoming COVID-19, but they will not end the pandemic if we cannot ensure equitable access to them.
Well, that's all we have for now. Thanks for joining me on Myanmar Today. I'm Henry Zin. Wherever you are, please stay home, stay safe, and do every bit you can to help fight this pandemic. I'll see you again. Goodbye.